Good evening. My name is Dr. David Doman, and welcome to another edition of Housecall. What are the challenges facing doctors practicing in Montgomery County? Find out right now. My guest this evening is Dr. Lynne Diggs, President of the Montgomery County Medical Society. Dr. Diggs, welcome to Housecall.
Thank you. It's a pleasure to be here.
So briefly, tell our viewers about your professional background.
Well, I'm an internal medicine physician. I'm in private practice for over 25 years. I've been living in Montgomery County for that long as well. And I am happy to serve as president of the Medical Society.
And tell us about your professional training. Where did you get your college and MD degrees?
I got a Bachelor's of Arts from the University of Pennsylvania. And then I came home to the University of Maryland, where I received my medical degree, and then did my residency at the Washington Hospital Center.
Very nice.
Yes.
So how does a physician who's practicing in Montgomery County become president of the Montgomery County Medical Society? That's a big accomplishment.
My path was unique. I joined the Medical Society in 2003, and I was quickly recruited into committee work, and from committee work onto the board, and I moved up the chain from secretary and to vice president and president-elect, and this year president.
Well, congratulations.
And it is my honor.
How big is the Montgomery County Medical Society? How many doctors that are practicing in the county are members?
That's a great question. We have over 1,000 physicians, about 1,500 to be exact, and we're very proud of those numbers.
And how does that compare to other county societies around the state of Maryland?
Right. We are the largest component in Maryland. Another fact that we are proud of.
Yes.
Yes.
And differentiate then the Montgomery County Medical Society from MedChi, the Maryland State Medical Society.
Right. As you said, MedChi is the state society. It is made up of components from around our state. Montgomery County represents part of that. Baltimore City, Baltimore County, as well as Howard and Prince George's, Anne Arundel, and the list goes on.
Very good. So what do you view as the mission of the Montgomery County Medical Society to help serve the public health needs of Montgomery County?
Our mission is threefold. We provide education, we provide advocacy, and resources. We feel that we can bolster our physicians, and that serves our population.
And give some examples of each of those parts of the mission.
For education, we provide, I want to say, seminars. We provide CMEs.
Continuing medical education.
Continuing medical education in a variety of topics. And as far as resources, we have practice management resources, as well as we have day-to-day resources. We have patient referrals. We have employee referrals. So it is quite a list that we provide to our physicians.
Now, historically, doctors have faced stress, which is inherent to being a physician, dealing with sick patients. But certainly, there are now unique evolving stresses for doctors practicing nationally and including, of course, Montgomery County. What do you view as some of the stresses that are evolving practicing medicine as we tape this interview today?
Financial pressures on doctors, certainly. Increasing regulations from the government and elsewhere. Insurance pressures from insurance companies. And dwindling physician supply.
And what are some of the financial pressures you've mentioned?
Trying to maintain the practice is a financial pressure.
I mean, an overhead.
And overhead, certainly overhead is increasing and reimbursement is decreasing, unfortunately.
So as a result of some of these emerging pressures, what is the toll being taken on physicians locally and nationally?
Well, what we're seeing is an increase in what we call physician burnout. And what I mean by that is a combination of cynicism and doubt, fatigue and exhaustion. And unfortunately, that bears weight on how a physician is able to care for their patients. And so in our community, we've done our own survey to look at our physicians, and we've discovered that about 50% of the physicians in our community have experienced a moderate to high level of burnout. Right. And this is in keeping with the national average as well.
So when somebody has burnout, how does that manifest in physicians?
In our area, what we're seeing is an egress. We're seeing physicians leaving practice, and they are either retiring early, they may go into the federal government, to the FDA or another agency where they're no longer seeing patients. They may move out of the area, even out of the country, and it affects the supply of physicians and access to patient care.
So if this trend continues, you think it may be more difficult for patients to see a physician?
Absolutely. Absolutely right.
Are you aware of any significant reports of clinical depression developing in our colleagues?
Yes, we are seeing elevated levels of depression, and we are experiencing levels of physician suicide within our own community. Really? Unfortunately.
How sad.
Yes, yeah. Very sad.
Yeah. So there's a saying, "Doctor, heal thyself."
Yes.
So what is the Montgomery County Medical Society doing to ameliorate this burnout rate in our colleagues?
We recently had a forum where we discussed this very issue, and we discussed burnout as well as physician resilience. And we are planning on having a physician health task force, which we've already started, and out of that task force we expect to develop a physician coaching and counseling service right in our medical society.
Very nice.
Yes.
Now, as you well know, there is a growing trend encouraged by the government for doctors nationally to embrace electronic medical records. Would you share with our viewers what you perceive as some of the pluses of embracing this technology, and to what extent has embracing this technology contributed to doctor burnout?
Well, I think the technology is certainly a good idea. It has allowed for the legibility issues that we are traditionally faced with to disappear. However, the fact that we have so many electronic medical record companies and services and different softwares that are not interoperable has made a challenge for physicians. For example, if you are a practicing physician and you go to 3 hospitals, you're likely going to have 3 separate electronic medical record systems to learn with passwords and layers of security, etc. So I think that while the idea of electronic medical records has been a good one, in theory, in practice, it has had the challenges that it's extra burdensome, it takes extra time, and we haven't had the data to show that there's been improvement in quality of patient care. Right.
Do you in your practice have an electronic medical record?
Yes, I do.
Okay, and so do you find that it has made you more efficient, or has it created more stress for your personal practice?
Increased stress, less efficiency, and longer hours.
Yes. And why is that? Why longer hours?
Because it requires some data entry, and unfortunately we didn't go to medical school to become data entry people. Yeah. So that a lot of us, myself included, are a little slower at entering the data, and it takes thought and it takes time, extra time, so that for me, it slows me down instead of speeding me up. Yes.
Have you found that your data entry is taking away from valuable patient time?
Absolutely. It does take away from patient time, and patients notice it.
Yeah.
They notice that we're focused on our computer screens sometimes and not focused on them as we should be.
Yeah. Yeah.
Right.
Well, let's shift gears then, given some of these healthcare challenges doctors are facing, to discuss what the county society perceives as some of the important healthcare issues statewide and in particular Montgomery County. What areas, in terms of legislation, for example, is the society focusing on?
We have looked at a variety of legislative issues over the last, I would say, 5 years. And what's been happening lately is it's narrowing itself into 2 areas. We have legislative issues around insurance companies and some reimbursement type issues. We also have legislative issues around the issue of what we call physician-assisted suicide. We have legislative issues still regarding the use of sugary drinks in children and the use of, we've had tanning bed issues, children and young adults, should they be allowed to use a tanning facility without parental consent.
Explain to our viewers why tanning beds would be of concern to the medical society. What are the consequences?
Yes, the consequences of that could be an increased risk in skin cancer rates, which we are very concerned about. Any cancer rates going up is concerning to us.
And what are some of the society's concerns with the health insurance companies?
A myriad of things, from paying doctors with credit card numbers, from delaying payments to us, from having tiny networks that patients can't see specialists because the networks are so small. So those are the things that we've been very concerned about over the last several years.
What about firearms? Has that been a concern?
It's interesting that you bring that up, because this year at the AMA meeting, the AMA requested that the government remove the ban on gun research. And our society supports that as well. We would like to see gun violence be researched so that we could look at it and see what the effect is on our community, as we feel it is a public health issue.
Yes, it was very eye-opening and troubling to me when I learned that the Congress has banned research into firearm violence.
That is correct.
Yes, well, hopefully that will open some eyes.
Yes.
We're going to pause briefly for a public service announcement. When we return, more with our special guest, Dr. Lynne Diggs, President of the Montgomery County Medical Society. We'll be right back.
Hey, Hard, what's this?
That's my resignation letter.
You're resigning. Why?
Because you're constantly ignoring me. You're half as active as you used to be, and you eat stuff like this. You've been putting me under a lot of pressure lately. That's why I'm ready to quit.
I forgot. I'll do better. Please, don't quit on me.
Okay, but remember, it's not what you say, it's what you do.
Listen to your heart. Don't let it quit on you.
Let's go for a walk.
Uncontrolled high blood pressure could lead to a stroke, heart attack, or death. Get yours to a healthy range before it's too late.
We're back. My guest this evening is Dr. Lynne Diggs, President of the Montgomery County Medical Society. Dr. Diggs, in the second half of the program, let's shift gears to discuss what you perceive on behalf of the society as some of the public health concerns in Montgomery County.
Well, my perception of the public health concerns in our county stem from the lack of access to health care. That's the first. And that's a variety of issues around that. We can talk about that. The fact that there's lack of access to health care could possibly cause increases in cancer rates, heart disease, obesity, high blood pressure, and diabetes. Those are the main things that affect our communities. And if those issues are not addressed in a timely fashion, then patients are going to be more likely to use the emergency room services where they're more critical. They may need hospitalization, which of course is more expensive entry point into the healthcare system. And the problem is we don't have enough primary care doctors in our community who are accepting patients or who are accepting insurance or who are not in a concierge model practice, so that our patients find difficulty accessing the primary care system.
Now, when you say they have difficulty accessing the primary care system, is that because there simply are not enough primary care doctors to go around? Or is it that despite the Affordable Care Act, there still are people without insurance coverage?
There are people certainly in our county without insurance coverage. However, of those patients who do have insurance coverage through the Affordable Care Act, there are not enough primary care physicians in our county to serve the needs of all of the population.
Do you have any ideas of what the state could do to encourage bringing in primary care doctors to the state, including Montgomery County?
Possibly loan forgiveness programs for the younger physicians coming out of medical training. The other issue is looking at the reimbursement rates for primary care physicians to encourage those who are serving the community to stay and to see more patients.
How does reimbursement for doctors in general in Maryland compare to reimbursement to our colleagues elsewhere around the country?
It's the lowest of the 50 states.
So do you think that serves to discourage doctors from coming to Maryland?
I think it does, because Maryland is an expensive state to live in, but the reimbursement is the lowest in the country, so it's difficult to balance that.
And has the state legislators attempted to intervene to encourage doctors to come to the state?
I believe they have considered some of that in some of the legislative efforts, but I don't think it's enough. We need to do more.
Okay, well, ultimately, their constituents, our patients, will make it clear that there's a problem.
Absolutely.
Yeah. So what can residents do to help their personal health as well as some of these health care issues?
On the personal side, I think it's important that our residents in the county take care of themselves. And by that I mean, are they eating properly? Are they getting enough sleep? Are they taking their medication? Are they exercising? And certainly we know that these things are ways that you as a patient could improve your own health status. But it's also important to stay in contact with your doctor, primary care doctor, as well as specialist.
And what kind of public service is the Montgomery County Medical Society providing for the public?
We have a doctor find service called Physician Find, where you can call our society and ask for whatever type of physician you're looking for.
Any specialty?
Any specialty.
Or primary care?
Exactly, any primary care or specialty.
And does the society participate with any health fairs or things like that?
We participate with health fairs, and we also have a connection with Montgomery Cares program for uninsured patients, and we'll be working closely with the Nexus Montgomery project.
Could you explain what that is?
The Nexus Montgomery project is a collaborative effort, I should say, between hospitals and primary care, looking at specifically the Medicare population, the senior population who may be living in assisted living facilities or independent living facilities in our county, to try and improve not only their access to care, but also their health outcomes.
And many of our viewers are concerned about the rising cost of medications, pharmaceuticals. What is the state and the county societies doing to try to help out with that?
This is a hot button issue right now, and we are all very concerned about this because it affects everyone. Montgomery County and the state MedChi, Medical Society, we offer a prescription discount card that is available through the physician office to take to the pharmacy, and that could potentially lower the cost of your medication.
So viewers, if they go to any of their doctor's offices, may be able to get these cards for free?
Yes.
Okay. What are some of the local programs available for uninsured patients in Montgomery County?
We have Montgomery Cares
Which you mentioned.
that I mentioned. And also I would mention that Holy Cross has 4 health centers in our county that see uninsured patients.
And these are patients that if they have no insurance at all, they can still get health care?
Correct.
Okay. What do you foresee happening with health care in Montgomery County, let's say in 5 years?
I think what we're going to see in our county is continued merging of health systems. We're going to see practices that were traditionally smaller practices merging and becoming larger practices, what we call supergroups.
Mm-hmm.
And I think we're also going to see a change in the way doctors are reimbursed in our county. It's called value-based care. And that is going to happen within the next 2 years. My prediction is that within 5 to 10 years, I don't think we're going to see many physicians in independent private practice. They'll be affiliated with a larger group, or they'll be affiliated with the health system such as MedStar, Johns Hopkins, Trinity, etc.
We have multiple hospitals here in Montgomery County. What is your sense? Do you think any of those may consolidate further or disappear?
Wow, that's quite an image. That's a risk. I think most of our hospitals are strong now, but certainly in the future, it is possible that they may not be able to survive the current economic climate.
Yeah. There is a program called CRISP. What exactly is that?
CRISP is a health information exchange service that is available in Maryland. And in our county, we are proud that many of our doctors are part of CRISP. I am one of those doctors. And what it allows is for doctors to be able to share information in a secure fashion via the web, via an electronic medical system. So that, for instance, if a patient goes to a hospital emergency room, they may have just been discharged from another local hospital. That local hospital would then have put their information into the CRISP system, and the hospital doctor from the second hospital can access that and find out what has been done previously, so as not to drive the costs and the expenses up, and to also provide, I would say, consolidated care to that patient, so that we're not repeat testing and doing things that have already been done.
Now, some of our viewers may be concerned about the security of a system like that.
Absolutely, and I think the state has taken extra effort to make sure that the CRISP system is very secure as possible, and that will allow information exchange across the entire state.
Now, as you all know, one of the hot button topics for several years now has been passage of the Affordable Care Act, Obamacare.
Yes.
What do you think will be happening to the Affordable Care Act in the years ahead?
I think the Affordable Care Act is a good place to start. It certainly provides health insurance for many people who couldn't otherwise afford to get it. That part is good. The part that may need to be changed or tweaked is on the supply side. We need to make sure that people who have health insurance have access to health care, and especially a physician, a primary care physician. So I think the Affordable Care Act did not address the issue of physician supply.
Do you think it'll be repealed, or is it here to stay?
I don't think it will be repealed. It's here to stay.
Yeah, I agree with you.
Yes.
So would you, what is your sense about what doctors are telling their children around the country, projecting ahead to the future? Do you think a doctor who has a child in high school and the child's beginning to plan their going to college, majoring, planning a career, What do you think doctors locally and nationally are telling their children about a career in medicine?
According to the Physician Foundation Health Study, which was recently done, 49% of physicians are not encouraging their children to become physicians. And this is a very sad state to me.
Yeah. Why is that?
I think it's because of what we've been talking about, the extra pressures on physicians these days, the working conditions that have changed, the loss of autonomy, the commodity focus on healthcare as opposed to the compassion focus. So that's discouraging physicians to recommend our profession to others.
It's a pity.
Yes.
Projecting ahead, though, if this has been a period of transition locally and nationally, where doctors who are used to one business model it's now evolving into consolidation and potentially progressive employment. Do you think that may change in 10 or 20 years, where it's now corporate medicine, and it's just a different sort of expectation for young doctors, that they will have grown up in that sort of environment?
Yes, I do believe that there will be a transformation in the way medicine is practiced and the way it's viewed. And fortunate or unfortunate, it probably will involve a corporate edge to it. It will have a corporate edge to it.
And therefore, by extension, our patients will have to change their expectations.
Yes.
It'll no longer be the sort of personalized care that they've been used to all these years.
There's a potential for that. I'm hoping that the pendulum will swing the other way and we will be able to maintain our autonomy and our cottage industry type style of practice.
Given that it's getting progressively, I'll be kind here, complicated with the different insurance companies, do you foresee a day when the pendulum will switch towards just a single payer system, where we'll take something like Medicare and nationalize it, at least as an option for everybody?
It's possible.
Yeah.
It's certainly possible, and it may be that some of the changes that we've seen with health information technology, as well as the Affordable Care Act and other legislative changes, may be paving the way for a single payer system. I don't think it will happen all at once. I think it will be done gradually.
I agree.
Yeah.
Well, Dr. Diggs, I do want to thank you for joining us on Housecall this evening. If our viewers have any questions, how can they reach you?
Through the Montgomery County Medical Society. I'm happy to give the phone number, 301-921-4300. Let me repeat, 301-921-4300, or montgomerymedicine.org.
Thank you for joining us at Housecall.
You're welcome.
My thanks to this evening's guest, Dr. Lynne Diggs, President of the Montgomery County Medical Society. Thanks to my terrific team here at the studio, but most important, thanks to you, the viewer. We've now expanded our broadcast schedule to prime time 5 times a week. If you have any suggestions, you can reach me at my practice website, montgomerygastro.com. As for our next show, it's going to be a very interesting show. We'll have Dr. Grace Ahn and Dr. Jeffrey Potter, noted rheumatologist, and we'll be discussing updates in low back pain management and gout. See you then next time for another edition of Housecall. Good evening.